Measles. The rubeola virus, commonly known as measles, is a viral infection of the respiratory system as it replicates itself within the mucus and saliva of the nose and the throat. It is a highly contagious viral infection and can spread easily unless prevented. Measles present many symptoms and have caused millions of deaths in the past worldwide. However, through vaccination, there is now a low death rate. Measles is caused by a virus, a paramyxovirus. It is extremely contagious and has caused many outbreaks. The virus replicates within mucus and saliva of the throat and nose. Transmission from an infected person to a non-infected person occurs when a droplet from their nose, throat, or mouth is released into the air. This occurs when the person coughs or sneezes. These droplets holding the virus then land on surfaces or are breathed in. Anyone within close proximity to a person who is infected can become infected themselves. Some examples of transmission are sharing saliva, such as drinking from the same glass as an infected person, or sharing food or eating utensils, touching a contaminated surface and then putting your hands into your mouth, and airborne transmission through sneezing or coughing. There are many symptoms connected to measles. 10 days after exposure to the measles virus, it is expected that a person with measles has a fever of at least 38 degrees Celsius, a runny nose, tiredness, coughing, and sore eyes, or sensitivity to light. Approximately 14 days after exposure to the measles virus, Koplik spots may appear within the mouth of an infected person. These spots are whitish or greyish and approximately 1 to 3 millimeters in length. The spots are located opposite the molar teeth. However, they can easily spread to cover the whole mouth and last for around 12 to 72 hours. Generally, 3 to 5 days after the start of the symptoms, a patchy red rash appears. It is known to begin as flat red spots and eventually have small raised bumps on top. The rash typically starts on the face, spreading downwards to the neck and to the rest of the body. The rash usually lasts 6 to 7 days and usually improves 48 hours later, turning into a dark brown color. An infected person is considered contagious 4 days before to 4 days after the rash appears. There is no antiviral treatment for measles. However, medical professionals such as nurses are able to provide medical care to help relieve symptoms and prevent any further complications. For example, a nurse can administer vitamin A as it is effective in reducing the severity of symptoms and making symptoms more bearable. As a guardian or caregiver, the best evidence-based practice they could apply is that of preventing measles through immunization. In the past, measles was exceptionally present, especially in children, as there was no measles vaccination. This caused millions of deaths worldwide. However, since the vaccination has been made, it is almost impossible to contract the virus. The reason why a caregiver or a guardian should use vaccinations in order to prevent measles is because once someone is exposed to the virus, they will gain lifelong immunity against measles. Vaccinations are the safest way to do this.